2, 3, 4, 5.
Remember, 96 is the number you're trying to work your way back up to, but we're going to start it just a little bit lower, okay? So if it's a little loud, tell me right off the bat, and we can turn it down a little bit and gradually work you up, okay?
Okay.
All right, here we go.
Okay, so I'm going to start, but then I can change it.
Yeah, leave it.
Because I'm already on.
Yep, you got all highlighted, so this is the big one. When you get started, it's game time.
Okay.
All right, here we go.
Are you ready?
Here we go.
I heard it.
Can you hear me out of your ear right now?
It's loud.
Mm-hmm.
It's buzzing.
Turn it down a little bit. 2 or 3. Is it a little overwhelming to you?
Well,
Can you?
it's annoying.
It's some of the sounds are going to sound a little bit weird.
Yeah.
So can you hear me well through it right now? Can you understand what I'm saying through it?
No.
Okay,
No.
and that's fine.
All I hear is the noise.
Yeah.
Yeah.
Okay. So it's going to get a little bit better over time. We got to gradually work it up.
Yeah.
There's a big misconception, I feel like, when people first get these things turned on, you don't hear
No,
perfectly.
I'm just hearing noise.
Yeah, for sure. Okay. What I'm going to do is I'm going to cover my mouth up and I'm going to make some sounds, and I just want you to try to mimic them back to me, okay? Yeah. E. Here we go. Ooh. Mm-hmm. Shh.
Shh.
S.
Shh.
E. Mm-mm.
Ooh, ooh.
I'm turning it up as I'm talking to you. Can you tell?
Oh.
I know it sounds a little odd.
Louder.
It's getting louder? Good.
Louder.
I want to make sure that it's comfortable sounding for it. I want it to be loud.
It's loud.
But I want it to be loud but comfortable. I don't want it to hurt. You can see it.
It's pretty far.
All right.
Is it good enough then?
Should be. All right. How does my voice sound to you right now? Does it sound clear? Does it sound funny? In comparison to what you heard when you first came in here the first time you ever met me, what does it sound like in comparison? Am I louder than I used to be?
I wouldn't say it's louder. I'd say it's more high pitched.
Okay.
And it's,
You're the
you
first person?
sound like a girl.
Oh,
Yeah.
I'll take that. You're the first person to ever tell me that, so I'll take that.
I wonder how I sound.
What does Emily sound like?
How do I sound?
Go ahead, say it again.
How does my female voice sound to you?
Sounds similar to his, but a little bit different.
Okay.
I could probably tell the difference.
Okay.
between the two. It doesn't sound normal.
Okay.
You will get used to that, and it will start sounding more normal to you, especially when you're using your hearing aid in comparison with it.
Right.
Okay? We're going to try to do a few more words, too, okay? Airplane.
Airplane.
Baseball.
Baseball.
I'm going to ask you some random questions, and I just want you to tell me the answer to them if you understand it, okay?
Okay.
All right. How did you get here today?
I drove a car.
Do you know your mailman?
Yes.
What is his name?
It's a lady named Karen.
This is getting me.
I know.
I'm having a hard time. Sorry. Okay. You're doing really, really well. You're basically having to learn what sounds sound like again. You are one of the best lip readers I have ever met in my entire life. So that's why I'm trying to give you a sound, what it sounds like, before I tell you what I'm actually saying.
Yeah.
Does that make sense?
Yeah.
Good. What we're going to do is you're going to have this as a program to start with, and I'm going to give you 3 more that you're going to, every few days, you're going to click that one. It's going to get a little bit louder and a little bit louder, because I want to work you up where you need to be hearing everything. That way we can start working on you understanding speech a little bit better with Katie, too. It's low, but we're going to give it a shot. Get real quiet. It's a lot different when they're both working together at the same time, isn't it? What do you think?
This is really loud.
Yeah, I had a feeling it would be. I'm going to save your hearing aid settings the way they are, and we can go back and we can adjust the implant a little bit. Is it painfully loud? Yeah? Okay. We can turn it down a bit.
I don't hear anything over here.
Okay. Go to fine tuning. Is that getting a little bit louder? Can you tell a difference in it right now? Keep going. Okay. Get a little louder now.
That's
Slowly but surely. Getting a little bit louder.
better.
Okay. All right. Go up a little bit more. It's getting a little bit better and easier to hear, understand. Give me another one. All right. Is that a little bit better?
I think I hear something over here now.
Okay. Go up a little bit more. Turn those down a little bit. Hit all. Do you still hear that echo thing anymore? Is it gone?
Seems like, not over here,
Okay.
but over here
Okay.
I do. Just seems like they're not totally working together.
Exactly. Well, you're hearing completely different on the left ear too. I don't want to change it too much because I want your brain to kind of meld those
Okay.
together. Okay.
That's fine.
Okay. Ooh. Okay. Now I'm gonna hit that.
I heard a buzz.
Okay. I'm gonna hit the program button. Tell me if you hear it. Okay.
Ding, ding, ding over here.
Yep.
Mhm.
So your hearing aid is working in conjunction with your implant right now. So when you're changing your, I'm sorry, I know I'm on the loud programs. Let me switch back. There we go. This is the first one. So when you're hitting that button, you're going to hear that many beeps for what program you're in. So when it beeps once, you're in program 1.
Okay,
Beeps twice, program 2, and so on.
I got it.
Okay? So now you'll be able to find it. And if your husband's ever standing close to you,
Yeah.
and when you're hitting that button, there's a little green light that will flash as
Okay.
many times as how many programs you
Okay.
have, so you know for sure too.
Okay.
You can try it if you want.
Yeah, reach back there and hit the button for me. Hit it for me. Did you hear it beep?
Well, actually, all I heard was the ding, ding over here.
It's letting you know that the program, because they're linked together.
Right.
It knows you probably hear a little bit better with that one at
Well, it's
first.
just louder over here.
Mhm.
Okay.
That's fine.
But
Because it's working the same way because it's
Right.
changing the programs over here too. This is going to be a bit of a process, but like I said, I want you to read to yourself out loud, or at least an hour a day.
Okay.
2 hours would be preferable, but I know some people get bored reading out loud to themselves.
Yeah.
It's fine.
Yeah.
Try to do that. If you're watching TV, try to have your implant on at all times with the TV on too. Your husband talking to you, get him to talk to you a lot and talk to him kind of slowly. That way your brain can process what those sounds are supposed to sound like, okay? Don't be anti-social. If you can go out and be around people, even if it is a little overwhelming, that's still stimulating that nerve in your head and helping it build back up to where it needs to be, okay? And I'll see you back in a couple of weeks, okay?
That sounds good.
Good to see you again.
Thank you
You
so
did
much.
really well on the
Yeah.
first time.
Thank you.
Absolutely. I'm glad to see you doing so well so
Yeah.
quick.